I am Robyn Johns, the Chief Pharmacist for National Pharmacies and the South Australian and Northern Territory Branch President of the Pharmaceutical Society of Australia. I'm here today to talk to you about how we all can keep safe and well during this COVID-19 pandemic. COVID-19 symptoms include a dry, sore throat, spiking in a fever. You will get breathing difficulties later on, but you also get a dry cough. COVID-19 is spread by people who they can have symptoms of the dry cough, or they can be spread by people who are asymptomatic, and it's spread by droplets. So I don't know if any of you have seen the ad that the SA Health put out last year on influenza, when you get that person sneezing or coughing out those droplets. It's those droplets, so if someone can breathe out those droplets, or particularly coughing, they will go a little bit further. So when this virus is coughed or breathed out, it can land on surfaces. And of course, as we move around in our daily life, we can touch these surfaces. So if someone has had the disease and then not meaning to, they should be coughing into their elbow or into tissue, but actually coughs onto a surface. If you touch that surface, then you touch any of your eyes, nose or mouth, then you can actually give yourself the disease. Coronavirus doesn't spread it on its own. It actually needs people to spread it. So it's everybody's responsibility to help reduce the spread of this virus. And how we do that is ensure that we have really good hand hygiene and make sure we comply with all the social distancing recommendations. Not going out, staying home as much as we can, and staying that 1.5 metres away from other people. Good hand hygiene is really important at this time. And we do know that hand washing with soap and water is better than hand sanitizer, but of course you can't have soap and water everywhere, particularly if you're out and about, so then we use hand sanitizer. Really important though that we actually wash our hands properly. None of them, there's just under the tap and off we go, but actually take the time, and there's some great YouTube videos on how to do it properly. That happy birthday twice, making sure you get between your fingers, on your thumbs and up your hands. Same with a hand sanitizer. I'm not sure if everyone has seen, but there's a great YouTube clip where someone has got this black ink on white gloves where they actually use a hand sanitizer, and you can see if you don't do it properly that it's not going to be effective. Well, here at National Pharmacies we're doing a few things. One of them is we're putting some screens in, acrylic screens between our team members and our customers, and that will help protect both the community and our team members to stay well at this time. We'll also have social distancing lines on our floors, and we just ask everyone to really pay attention to these to ensure that we do have social distancing between our team members and our customers coming in. We are also ensuring that we have enough hand sanitizer so that our teams can use the hand sanitizer in between, touching people's scripts or serving people with their cards. As a customer, you've probably noticed that these social distancing markings are in lots of other stores. I've noticed them at many of the supermarkets as well. So please respect that distance, particularly if someone's filling up a shelf or even at the cash register. Make sure that you do stand back, and if the assistant needs to come forward, please take a step back and protect you and them. Masks and gloves are essential for those people who are working with the sick COVID-19 cases in hospitals or at the GP clinics, people coming in who either are positive or showing very severe symptoms. They're the frontline people who need masks and gloves. In the community, masks only work for those people who may have the COVID-19 illness, and what it does is it stops those big droplets from actually then spreading into the community. If you wear a mask and you are well and you don't have COVID-19, it won't stop you getting the virus, because what happens, they get damp from your breath really quickly and humid breath. And once that happens and you don't change them regularly, about every hour, you will get the virus coming through that mask as well. Now, of course, gloves, great, if you change them after every interaction. But what they do is they give you a false sense of security that I've got gloves on, I can touch anything I want. But the most important thing is that you don't touch your eyes, nose and mouth. And if you've got gloves on and you do that, it's not going to help, because if you've touched a surface with COVID-19, then touch your nose, and whether you've got gloves on or not, you can give yourself the illness. It's very important that all team members, no matter where you work, if you are feeling unwell, that you actually report to your manager, and your manager will recommend whether you go home or you need to go straight to see a healthcare professional. Whether it's influenza, COVID-19 or just a cold, it's important that we don't work when we're not well because of course we're going to spread that to our work colleagues. At this time, it's really important that we look after our own health, and that could be our mental health, but also our physical health. Make sure we're eating well, sleeping is really important as well, getting enough exercise, getting out in the fresh air, remembering you can only go out in twos though at the moment, and making sure you get enough water. And as we said, mental health is really good, so try and switch off, turn the television off. All we hear is COVID-19, COVID-19. Switch it off, go for a walk, smell the flowers, look after yourself. As we move into the flu season, it's really important that everybody gets their flu vaccination. We don't want our hospitals to be filled with people with influenza as well as COVID-19, so everybody get your influenza vaccinations now. Everywhere I have been over the last couple of weeks, frontline workers have been amazing. Most of them have been upbeat, giving great advice. And we just need you to be well and keep a positive attitude for everybody in our communities at the moment. And I'd just like to thank you again for an amazing job you're doing.